David Gilchrist. David's a professor of accounting at the University of Western Australia, and he used to hold a similar position at Curtin, so it's great to have him back with us here today. David's very active in research and practice on not-for-profit organisations and in human services in particular, and he's held various senior positions within government. His most recent research and engagement has been in the area of disability services policy and finance. And he's a regular commentator on these subjects in the media. I've certainly read a couple of articles that he's written in the West Australian, for example. I must admit, I feel a bit guilty. I do not know enough about the workings of the NDIS, and I'm sure I'm not alone in that, especially given its status as one of the most significant reforms in human services in Australia for decades. And so I'm feeling A, guilty, but B, I'm feeling very lucky because we're going to have David Gilchrist explain it all to us over the next 40 minutes. So I was really pleased that David agreed at quite short notice to give today's presentation, and I'm sure we're all going to learn a lot. So David, it's great for you to volunteer to give the presentation today, and I'll hand it over to you and probably count you in a few seconds. So over to you, David. Thanks very much.
Thanks very much, John. And I'll share my screen with you as well. Can everyone see that slide now?
It's all good from here, David.
It's all looking good from here, is it? Seems to be. I'm just going to stop that for a second and share again. I'm not sure what's happening here, folks.
David, we could see it before. We could see a little bit down the side as well, but we could see the slides fine enough if you want to try it again.
All right, how does that look?
That looks like we're looking at you. Here we go. I think it's going to work in a second.
All right,
that's the one. We're in.
Sorry,
thanks very much, everybody. Now we'll start the session.
We will indeed, and sorry about that, a technological difficulty. Thanks very much, John. And first and foremost, I'd like to also join you in acknowledging the Whadjuk people of the Noongar Nation, from whose lands I'm delivering this presentation, but also obviously acknowledging all of those First Nations people from around the country, for those people observing this presentation elsewhere. I must admit, in terms of determining what to call this presentation, my first thought and my first instinct was to actually say the rhetoric of the NDIS versus the reality, and I think that is a very good sub-clause or a strapline for this particular presentation. And what I wanted to really emphasise was that there is, if you like, a public face of the NDIS, and then there's a practical face around the economics of it and how it's actually playing out, not just in Western Australia, but across the country. And to that extent, I think it's really important to think about this particular presentation in two contexts. The first context is that, of course, the NDIS was created at the end of a period where states and territories had their own disability services systems, and those different states and territories had different qualities in terms of how those systems were constructed, funded and implemented, and also had different arrangements in terms of what I term the government and not-for-profit interface, or the nexus between government and not-for-profit organisations that are largely the funded organisations that provide services in disability services, as well as broadly human services around the country. Nevertheless, in this presentation, I'll give a very quick overview of the NDIS and raise some issues, or to give you a bit of an idea of how it works and make sure we're all on the same page, but also to raise some key issues that I think are really important in the context of this presentation. The second thing I'll do is have a look at the economics of the NDIS, and particularly the mismatches in policy decision making and the rhetoric that we often express around the National Disability Insurance Scheme. The rhetoric compared to the reality are two different things, and I want to arrive at that, I guess, with some concluding comments to give you a sense of what I think needs to be done to try and rectify these issues, but also hopefully to raise some questions and commentary from the audience so that we can expand on those ideas a little during the question time. Okay, so the NDIS, or the National Disability Insurance Scheme, as many people are probably aware, effectively commenced its operations in 2013 with a trial period in a number of trial sites around the country. And then gradually since that time, so over the almost 7 years of its operation, has been slowly rolling out across the country, and with the intention of speeding up really in the last couple of years. In that regard, I guess there's a couple of things about the NDIS that are really important. The first thing is, of course, the purpose of the NDIS, and the reason, I guess, that the NDIS was so popular and so well and easily adopted and accepted by the outgoing Gillard government and also the subsequent various coalition governments, was because there was a need in disability services to do two things. The first thing was to introduce more cash into the system, to put it bluntly, to have financial resources that could support disability services more effectively. And the second thing was to be able to expand disability services in terms of the catchment of those people that were entitled to services, and to ensure that the 500 or 100 or so thousand people and what we call their natural supports, their families, their friends and others that they work with, are able to get the services that they need in order to live their lives. I guess one of the things about that is that disability services, like more broadly human services, are services that are absolutely critical for many people to be able to live their lives and to be able to even maintain health and to participate economically and otherwise in the Australian community. Without those services, they simply can't achieve those outcomes. And therefore, one thing that is important to understand up front is the fact that disability services, from the consumer's perspective, or what we call the user's perspective in the NDIS, are services that are not able to be substituted or neglected. They're services that absolutely must be had in order to be able to live your life fully. So when I get to the point of starting to talk about the economics of the NDIS, you'll understand and hopefully refer back to or think on that particular comment, because at the end of the day, when we think about an NDIS market particularly, we need to be aware that the users are absolutely reliant on these services in order to live their lives. The second thing that the NDIS was intended to try and implement in order to mitigate some of the needs across disability services in Australia was to enhance choice and control from the user's perspective. And choice and control is a really important aspect of human services broadly, so in aged care, in disability services, and in the many other service areas, mental health and so on, where it's possible for users to actually not only access services, but to be able to design or collaborate to be able to identify what they want, when they want it, and who they want to provide those services. By and large, and this is a very general statement, in previous systems, state and territory-based systems, some of those choices weren't necessarily available to people with disability, and therefore they weren't in control of who they got to give their services, when those services came, or indeed even what those services might be. The whole idea of the NDIS is to give them that control through a planning process, which they collaborate with the NDIS to be able to develop. The other thing that is really important, though, in the context of using quasi-market pricing structures to impact behaviours, so in achieving choice and control, the NDIS is structured so that it is trying to be an economic market, but at the same, in the context of trying to drive particular behaviours, particularly those behaviours of disability service providers, to try and ensure that they're efficient and effective, but also allow for choice and control in the context of service delivery. Sustainability, though, of the largely not-for-profit disability services sector is in some jeopardy as a result of the use of quasi-market pricing and also poor pricing arrangements under the NDIS. In effect, the NDIS was established and instigated with a budget of $22 billion, which I'm sure many people remember that figure, on the basis of, or rather calculated by reference to, how much money the government could put aside for disability services, as opposed to identifying how much money disability services actually cost to deliver. Up until this point in time, there is very little data that actually goes through and confirms how much it costs to deliver disability services, and the pricing structures that have been developed by the NDIS in order to pay for those services are not based on cost, they're based on the amount of money that is available. This is really potentially impacting significantly not-for-profit disability service providers, and I'll come to that a little bit later. But without not-for-profit disability service providers across the country, then the provision of services is very, very tricky. And indeed, in a lot of areas, particularly in remote service areas, remote communities and so on, there is no services being delivered at all. The way we know whether or not services are being delivered, though, doesn't relate to the typical economic development of a model to identify what demand might be for particular services, but rather with regard to those service accessors, those service users that already have plans with the NDIS, we're able to work out just how much of money out of those plans they're spending. Last year, the NDIS reported in excess of $2 billion in underutilisation. In other words, money that wasn't spent, that was actually allocated to be spent, simply because those people that had received the funding plans were unable to access services by and large. The other thing that we don't tend to do when we think about the NDIS, and certainly if you scan media or scan some of the public discussion around disability services in Australia, you'll find that mostly people refer to the NDIS itself and the problems associated with it. This makes sense because the NDIS is an enormous program, and John mentioned in his introductory remarks that it's one of the most complex programs that's been introduced in Australia in social terms. I'd suggest to you it probably is the most complex program that's been introduced in Australia in social terms. Disability services is incredibly complex for geographic reasons, for care mix reasons, the types of care that are required, and also for the fact that most people with disability are not comparable with each other. They have different co-disabilities and different issues that they're trying to manage in different locations with different economic and other contexts in which they're trying to receive their services. And so in that regard, it's important not only to consider the NDIS, but to actually consider or undertake a system-wide view of disability service provision. That is, if you put it simply, a person with disability not only gets access to NDIS, they typically get access to other transfers from government, such as pensions and so on, but they might also get access to education supports, health supports in state health systems, and access to other services provided by government and by other providers. We don't take a system-wide view, therefore we don't plan NDIS or structure NDIS in order to ensure the whole system is efficient. We tend to look at components of the system without thinking about how they actually connect together. The final point that I think is really important in all of this, and why this is an important subject for us to discuss, and why it's an important subject for scholars and others to be looking at it all the time, is the fact that at the end of the day, the users are actually the shock absorbers of the system. In other words, while I'm concerned in my work to try and get the NDIS pricing policy right, to look at a system-wide view of disability services in Australia and to work on the efficiency and effectiveness of that system, where we fail, where the system fails, where the NDIS fails, or where not-for-profit service providers fail, is where the users actually take that risk and take that responsibility. They're the shock absorbers of that failure, and therefore ultimately we have to get the system right in order to be able to ensure those users are getting the services that they need. Now, what does the Simplified Australian Disability Services System look like? Well, here's a graphic that just gives you a little idea of the major components. While the NDIS is a very big part of this disability services system, it's not the whole system. And while the states and the Commonwealth contribute to the NDIS, which ultimately turns into services provided to individuals, hopefully with choice and control, the states and territories still put in a lot of additional money over and above the money that they contribute to the NDIS toward the support for supports required with disability. That money goes to not only the individuals and the service providers themselves, but it also goes into things like workforce development, professional development, service providers, and so on and so forth. And so you can see, even with this very simplified structure, the provision of services to the average NDIS participant, the average user of disability services, is quite a complex consideration. And without looking at that whole system, we're in grave danger of not only having that efficiency and effectiveness, the economic impact being poorly arranged, but those people who are receiving services ultimately bear the brunt of the negative outcomes that might come with poor organisation. So what does it mean? Well, let's just go back to some basic economic perspectives. I don't want to labour this area, but I do think it's important that we're all on the same page, and particularly because the way the NDIS has been structured with the use of quasi-markets, it does come back to the idea of using economics or economic theory to drive the behaviour of the players, to drive the behaviour particularly of the players in the market that are providing services, but to also use that market nomenclature, if you like, that market rhetoric, to be able to identify and to signal to all parties in the market what's happening and how things should work. So economics is used to drive behaviour largely in these kinds of arrangements. But economics also helps us to identify and to predict what kind of outcomes are going to be achieved. And I think this is one of the major problems with the NDIS and other quasi-economic structures that have been put in place to fund human services in Australia. The predictability aspect of these models hasn't really been used by policymakers effectively. In other words, policymakers have a tendency to consider quasi-markets and markets as being relatively the same thing. And of course, they're not the same thing. And I'm very happy in question time to talk about quasi-markets a little bit more thoroughly. But at this stage of the game, I think it's important to remember that effectively a quasi-market is a structure that's set up between government, the user, and the provider of the services, and within a rules framework set up by government, but with rhetoric, with language that helps to get people to think in economics terms, in market economics terms, rather than thinking about, for want of a better phrase, simply receiving a handout or a grant from government to deliver services. This predictability, though, is a really important issue because we're seeing not only in Australia are we not actually understanding and modelling the outcomes that are being achieved in the context of the NDIS, but we're also ignoring human services quasi-market failure in the United Kingdom, in Canada, in the United States, where there is plenty of evidence of situations where this doesn't work in the context of human services. So markets language is certainly the flavour of the day, and I think quasi-markets are in many people's minds essentially the same as markets as far as the operation and their thinking. But I guess there's a couple of things about that that are important as well. First and foremost, this is economic theory. That means it's not gospel. It's actually just theory, and markets theory is very strong and very popular in Australia today, but it's not necessarily the right solution. From my perspective, I think one of the things about the NDIS, particularly and human services generally, is that we need to identify the right market solution for the particular service, which could be anything from on a spectrum from pure market economics through to direct transfers from government in grants using, if you like, a welfare state model. At the end of the day, though, it's economic theory, and we need to collect data to be able to understand what's going on. So additionally, differing problems have differing economic solutions. One of the things about the NDIS is we always talk about disability services as if it's one particular service provision. In fact, it's an aggregate of different services that are mixed for each person in very different ways in order to meet their needs, and particularly in the context of choice and control. And therefore, different problems are going to have different economic solutions, as I said before, on a spectrum, everywhere from market solutions through to state socialism or welfare state arrangements that are necessary to ensure the resources live where they need to be delivered. I guess that's why mixed economies work better than any other economy. And Australia's mixed economy, I think by and large, has been very successful. But it's time for us to really look at how that mixed economy works in the context of human services generally and disability services specifically. In that sense, we need to apply the right economic theory to each problem, and we need to ensure that we're applying that theory in terms of the funding question. And the funding question is actually different to the actual application of the funding itself. In other words, one of the things that I think is really important, rather than identifying an amount of money that we can spend on disability services and establishing a price, one of the things that we need to do for sustainability is really understand how much it costs to deliver all of these types of services, and then work out what the finance gap is between what's available and what is needed. That's the only way we can resolve the resourcing issue effectively, and also, of course, to prioritise where those resources are allocated. So, continuing this market economics and quasi-markets discussion, first and foremost, I guess market economics at its basis is really about meeting demand for the right price. And this is really important for us to continue to consider, which you'll see in a minute in relation to the actual NDIS economic model, and what the differences are between a typical market, a generally accepted market, and a quasi-market, and how that might work. Secondly, I think the thing about market economics is it's a pretty comfortable idea for most of us, for policymakers and media journalists, and people generally in the community, understand how markets work, get how markets work, operate in markets all the time, and therefore it's a very comfortable idea. And talking in markets terms when we talk about human services is also comfortable. But I guess the other thing is, though, that it's also about alternatives. For it to work, the consumer needs to be able to do without the good or the service, while the provider needs to be able to charge what they want for it. In other words, for a market to work in human services, a user, participant, needs to either be able to substitute one service for another service, or one provider for another provider, and also has to be able to go without entirely if the price is not right, resources aren't there. In other words, instead of applying the normal market economics, quasi-markets operates in a way that ensures, hopefully, those services are still provided and the transactions are undertaken. What is really important to understand is that when we talk market economics rhetoric and we talk about demand and supply and efficiency in demand and supply, what we don't realise is, of course, that people need the services regardless of the cost. In other words, in quasi-markets, in the delivery of human services, the demand side is not elastic. People need to have those services in order to live their life, and therefore the market doesn't respond in the way that we would expect to for, say, Coke or Hungry Jack's or something, other consumer good or service. So we tend to use quasi-market economic structures to apply what we are comfortable with. So we talk about quasi-market economic structures, but we pursue quasi-markets as if they're real structure, real markets. In other words, we don't differentiate between them, we don't really understand how the economics of the disability services sector works. My view is that this is really destructive. So we've got a few more minutes here, and what I'd like to do in this section of the discussion is to show you the NDIS market structure and to make some comments about that, and then look at what the real market structure, underlying economic market structure is for the NDIS going forward. This is the published market structure for the NDIS. It's a price and quantity, demand and supply graph, which I'm sure almost everyone in the audience would be familiar with, or at least seen in some context at some time. So that you have demand sloping from left to right downwards, and supply sloping from left to right upwards, depending on the combination of price and quantity. And we know that the market clears at the point where demand and supply intersect, because that's the point where those wishing to buy services at that price equate with those wishing to provide services at that price, and therefore the market clears itself. This is the chart that has been described by the NDIS as guiding the pricing structure and guiding the management or the stewardship of what they call the disability market in Australia. You can see it's a fairly typical graph because there is an old demand curve, a pre-NDIS demand curve, moving to a NDIS full rollout demand curve, and a shift in prices over time. This is the target. The implications of this are several. The first thing is that it suggests that there is only one market or one service being provided. But I've already mentioned, of course, the NDIS funds a number of services, in fact, over 300 services on their price guide. And therefore, there's a number of markets with a number of different, all of which have different prices and different attributes. The second thing that's important is that there's an expectation both providers and users will act in accordance with our efficient markets theory. In other words, that they're homo economicus, and that if the providers can't provide the service, they'll simply get out. If the demand side can't pay for the service, then they'll simply go without the service. Both of those considerations don't necessarily have any merit because not-for-profit organisations can't typically shift their capital to do other things, but also they have established missions to provide these services. On the other side of the coin, on the demand side, it's very difficult to envisage people with disability having to go without services and supports for the reasons that I mentioned before, in terms of those services and supports actually help them to live their day-to-day life. So what does that mean in terms of the actual model of NDIS? So this is the model that has been published, it's been talked about, it's a model that just is used to describe policy and indeed to establish policy by the NDIS and government, and it's the model that is often reacted to, if you like, in the context of service providers and industry leaders. But what is the real model of the NDIS? What real supply curve look like? Well, we have typical price, of course, and as the price goes up, there's changes in demand and supply. And we also have what we call a unit of measure. And a unit of measure under the NDIS is an iteration of service, if you like, the typical business or widget, but that one-off service delivery that is being provided. Now, in terms of the demand and supply curve, because demand is inelastic, because people with disability need to access services and supports, it's a very different picture to that was identified in the previous slide and which is driving policy under the NDIS. In reality, demand is a vertical line because those people cannot, there's no elasticity in demand for many of the services, as I said before, and therefore there is no shift as the price changes in terms of the amount of services that are demanded. The price, of course, does change the nature of the demand, and so the supply side, according to price, is going to allow for the market to clear, providing the price is provided at the right level to meet that demand. If we start to apply, though, what's called the NDIS price plus state, so that price is the listed price under the NDIS arrangements, plus the amount of money that is paid by states to help with sustainability because the price is not sufficient, then we can see that there is a line identifying that price from left to right on the graph. You can see that there is an amount that's actually provided by suppliers under that price, S with sub-price NDIS. And you can see also, though, that there's quite a substantial amount of unmet demand because the price doesn't sufficiently allow suppliers to be able to invest to achieve that outcome. This is demonstrated in the lack of utility year on year, where those people who actually have NDIS budgets and have been recruited into the NDIS, so this is not all demand, but simply identified demand through the system, hasn't been met to the tune of billions of dollars. That means that those people aren't getting services because the sector cannot provide those services. I guess the other thing that's important to remember in the case of this economic model, and I'm sure there'll be questions and comments, is that the policy actually describes the aggregate markets. As again, I think this is really important. There are many, many different supports and services provided under the NDIS, and they all have their unique economic model. And aggregating all of those elements into one market model means that the policy outcomes are too aggregate, not specific enough. It's also important to remember there's a tripartite economic arrangement. So while we've pitched the main supply sides here on this graph, there's a third side that's a really important one, and that is the government side. Not only does government provide the financial resources, it also provides the policy framework around how those resources are to be applied. Importantly, investment won't be made by supply side. We're seeing this come through now with evidence in relation to the market's reaction to sustainability pressures that it's under. But if that investment's not made, the supply side can't grow. If the supply side can't grow, then even with price changes, it's impossible to meet it's already existing. There are short-term economic focus on this as well, and we're seeing tweaks around the prices of NDIS in order to maintain short-term economic arrangements instead of really looking at the long-term requirements for this system. Of course, if pricing doesn't work, there's a major risk for supply side in terms of quality control, and ultimately, of course, those service users are the ones that actually bear the risk here. Finally, again, this economic model, while it's the model in the context of provided people with disability, doesn't account for the whole system. We're not looking at the whole system in that context. To that extent, the Australian Disability Services System is really not being an element that figures well in the NDIS development itself. Indeed, the NDIS has been developed as if the remainder of the system simply doesn't exist. The system's complex, and as I said before, the economic models that need to be applied are also quite complex. We need to have the right mix of models going forward. The important thing to remember, though, is that these things work against each other for four fundamental reasons. First and foremost, the policy framework's not comprehensive. And so we're spending $22 billion or in excess of $22 billion of taxpayers' money without really having a comprehensive framework. We don't have a planned approach to the articulation of services, and indeed no industry plan to help guide the development of the sector, because we're really relying on this faux market to drive the allocation of resources. That allocation of resources is not affecting the outcome that we would like, and the evidence in relation to the NDIS rollout particularly is demonstrating that. There is no medium or long-term planning to give clarity and certainty to investors, which is a really important aspect, or to give clarity and certainty to those people who are accessing it. I think is a real detriment to the capacity of people to make decisions that they need to make. And I guess all of this really does reinforce the short-term focus, because there's no future state described, no investment support provided, pardon me, and the changes that are being put in place are very much tinkering around the edges, but rather than true reform system. At the end of the day, the economic model is given precedence over the policy and planning framework to the detriment of the system. I guess one really important thing going forward is that we actually have an institutional perspective on this. We develop a model before we develop or finalise the financial and economic arrangement to go with that. To that extent, we need an institutional perspective on all of this. Firstly, we need to recognise the systemic value rather than the NDIS as being a standalone element. The second is recognising that not-for-profit providers are actually a national asset. It's not a replaceable set of infrastructure, and certainly commerce for-profits aren't coming in and replacing the capacity of disability services. And again, that utilisation or lack of utilisation that's demonstrated year on year shows that the sector is not growing fast in that respect. The sector has a place in the national interest for that reason. And I think also that it has considerable intellectual property and experience that it can apply here, and therefore it is a replaceable sector. I think we need to be thinking about managing more effectively. So, having very quickly run through all of that, and acknowledge there's some quite complex issues that hopefully we can discuss more in question time. At the end of the day, we need to really be thinking about how we respond to this. I think again, at an institutional, national and systemic level, we need to be able to deal with this in a more complex fashion. First and foremost, there have been over 70 reports written on the NDIS since its implementation. Those reports cover all of the issues that have been identified and also offer some fairly good solutions, I think, in a number of significant areas. So we have plenty of knowledge about the problems. We also have plenty of ideas about how those solutions might be applied. What we don't have, though, is a comprehensive way forward that is not a tinkering about the edges with just-in-time modifications. We don't have a holistic, systemic view, and we don't build the system ground up where local decision-making is absolutely critical. In a system where it is very expensive, but where each individual user has a different set of criteria in terms of needs and supports, we need to be able to make decisions at the local level to ensure resources are allocated appropriately. This idea even extends when we think about communities and some of the remote communities, particularly where often a community solution is more important than an individual solution. Therefore, we need to be very flexible in the way the NDIS dollar is governed and how decisions around the allocation of those resources at the local level are made. So what are some of the things that we could actually do? One thing is we need is a comprehensive industry plan with short, medium and long-term strategic horizons so that the service delivery industry is able to invest and also have an idea of where it's going. Such a plan would also have a very strong indication to industry about how they might, what the sector needs to look like and what the industry needs to look like in the end state, what it's working forward. Secondly, we need a policy framework that supports that real local decision making. Ultimately, a policy framework that supports local decision making and that supports the aggregation of national dollars, if you like, because we do need Commonwealth money to make this work, means that we have to be able to chew gum and walk at the same time. But I think that is certainly possible in the context of human services. And if the states, the Commonwealth and the sector work well together, then that could be a policy framework that actually means local decisions are made so that resources are allocated effectively. And finally, we need to have responsible investment in order to support the process itself. One of the things that is wanting across human services, but certainly in NDIS, is investment in systems, investment in data gathering, the development of data assets so that we can understand what's going on, and also investment by government procurers, particularly at the state and territory level, where we need to be able to ensure that those people making procurement decisions understand how the sector works and what kinds of procurement decisions they should be making to achieve the best possible outcome. In other words, the not-for-profit government nexus is absolutely critical to delivering effective NDIS, as well as delivering any other human services such as aged care or what have you into our communities. Without that combination and that collaboration, without responsible investment to support itself, we're not going to see an effective NDIS anytime soon. Okay, I feel I've run through that fairly quickly, but I wanted to get through the material and have an opportunity to respond to questions and to be able to have discussion on this as well. So I might hand back to you, John, in terms of being able to moderate those questions and see what people might have to say.
Thanks, David. That's great. Can you hear me okay?
I can.
Great. Okay, so we've got a few questions here. It's I'll just get my Slido up. So anybody who wants to ask a question, remember, just go to slido.com and put in the code R016 and you can ask some questions. So we've got a few questions here. One of which was talking about, I mean, I'm just trying to work out, some of them are fairly similar, but here's one. You've been mainly talking from a system point of view. what are users thinking? I mean, he's got these 70 reports going on. What are the users thinking? And are they finding the services better or worse or harder or easier to navigate? And while we're at it, we might as well ask about what do the providers think? So, you know, you've been talking about what government's been trying to get out of it, but what are users thinking?
They're two great questions. So what do users think and what do providers think? First and foremost, there's a couple of realities around users and assessing users' comfort and level of satisfaction with the system. The first thing is that in some states around Australia, the reality is any additional funding and additional system, it's got to be an improvement. And so some of the states had very, very poor disability services provision. And some of those states indeed had very rudimentary supports offered. So therefore, the NDIS presents to a number of users around the country a very good services, or an improved service for many people. In Western Australia, if we can take a Western Australia-centric view, I think it's fair to say that in order to achieve a common level of service, Western Australia has had to drop the bar. And the proof is in the pudding, in the sense that a lot of the structures of the NDIS, so things like choice and control and local decision making, which we would like to see more of, the use of what we call local area coordinators, where there is a NDIS person or a person contracted by the NDIS to coordinate services, if you like, in regional and remote and local areas in the metropolitan area, are all things that came out of Western Australia. So we've effectively taken a downgrade in services compared to what was here before the NDIS came to play. I guess the third thing, though, in terms of consumer sentiment in this context, is that there isn't a great deal of evidence really identifying whether or not these people have got what they want out of it. And this is really important because at the end of the day, satisfaction surveys are conducted en bloc. In other words, every type of consumer asks their opinion and the results are aggregated. Whereas if you start to segregate and break down, you'll find that different types of disability and users that have those disabilities have different experiences of the value of NDIS. And so it's a much more complex question than just simply saying, you know, is everyone happy with Coke rather than Pepsi? I think in terms of users, almost uniformly, users are under extreme financial pressure and extreme pressure to be able to identify resources, change their business models and structures to be able to be compatible with the NDIS. So my suggestion to you is that those organisations that are providing services would be struggling to say that it's a wonderful system.
Okay, a couple of questions to just follow on from that. Firstly, somebody wrote a nice little comment saying choice and control has become reasonable and necessary. So
yeah,
all with capital letters, so that's okay. One of the questions also, you talked about the West Australian situation, so there was a couple of questions there. One was, which I wrote right at the start, was in retrospect, should WA have even signed up, and could we withdraw if we wanted to? And then following on from that, at a broader sort of national level, was it a necessary response to a failure of federalism or a failure to appreciate the advantages of federalism? So firstly, you know, in the specific case of Western Australia, what should we have done and what could we now do? And secondly, if you've got this big variation in states' performances, was the only way to fix it to have a national system, or were there other ways you could have used the federal system to fix things up?
Yeah, look, the short answer is in relation to WA, my belief has been all along, and I wrote one of those articles for the West in this context as well, to say that we shouldn't have simply signed up to the NDIS. I think separate what was called WANDIS or WA NDIS at the time, which was a mixture of the WA system and the National Disability Insurance System, was a much more effective system for Western Australia for a whole lot of reasons, not least of which local government personnel were able to continue to use their IP and experience to ensure services were delivered properly, rather than having Geelong decide what should be done in Broome after you've explained where Broome was to them. So I think that, in my mind, there's no argument WA shouldn't have joined the NDIS in that way. And I think another argument for that is that we should have sat and watched and seen what happened. and then renegotiated our arrangement with the Commonwealth based on experience rather than based on prospective outcome. Secondly, WA can simply get out of the agreement, if you like, when it comes up for renegotiation. So the bilateral agreement is a 5-year agreement, and so we can simply allow that to lapse or to give notice. The third thing that's really important here is that in WA particularly, we had a lot of arguments, you would recall, about WANDIS and NDIS and whether we should join or not join and whether we should be part of a national system. Every state and territory has a separate bilateral agreement with the Commonwealth. It's a bilateral agreement, not a multilateral agreement. So I think it's important to note that different agreements have different arrangements and different good points and different bad points in terms of how it applies. So for instance, some jurisdictions have got provider of last resort arrangements. So what happens if someone suddenly finds themselves in trouble, suddenly finds one of their children in trouble, needs support? Under the NDIS arrangement, you simply can't get funding to be able to provide. And so some governments have made arrangements with the NDIS to allow that to happen. Other governments haven't.
Thanks. And just following on from that, in terms of if WA, in your view, should not have joined,
yeah,
what is the rationale for joining? That what the financial risk is more on the Commonwealth side in terms of we've got a fixed amount and the Commonwealth's going to have to pay more, or what's the rationale for getting out of it?
The rationale was, and I
get into it.
Yeah, I think the rationale was on the WA government side of the fence simply was very simple, and that is that we can reduce the amount of administrative cost that is doing that. In my view, that was such a marginal cost, and the NDIS, of course, is putting a third of its resources in. So I'm not sure that that's really getting what we need. The second thing is that disability services is an incredibly complex area, incredibly complex. And I think state and territory governments may find that there's a political incentive to hand that on to another jurisdiction as well.
Right. A couple of other questions. So another good comment, really, which is someone saying, right, so we had a better system and we've just thrown it out. Okay.
Yeah. Yeah.
Doesn't sound too clever to some extent. Right. Now this question is where do private providers fit in? Because someone also has a question here about from a worker's perspective, there seems to be less money to support training and good qualified staff. So why allow for profits when there actually isn't enough money to go around anyway? So where do the private providers fit in here?
So this is a fantastic area for discussion, and we could go for a long time on this, but I'll make just a couple of clear points. In human services, so not just disability services in Australia, but human services, the charitable sector, if you like, is the second biggest employer in Australia, behind government. So, in excess of 1.3 million people are employed in these kinds of activities, and they're low-paid activities, but they're incredibly important activities. Economically, they're important because if we talk about stimulus packages, and if we're going to stimulate the economy, this is the sector to put money into, because low-paid people consume. They spend their money on day-to-day life. They don't go and buy a second property or go to Europe or what have you. And so I think that's the first thing. The second thing is that there's been a lot of talk about for-profit coming into human services generally over the last 10 years. And in the NDIS particularly, there's been a lot of talk. Two things really, though, have occurred. One is that a lot of what you might call sole trader professionals have created companies and then delivered their services as sole traders. And so while the statistics seem to suggest that about 50/50 not-for-profit and for-profit deliver services in, say, disability services, in fact, the vast bulk of services are delivered by not-for-profit organisations. The commercials are really professionals that are simply OTs, physios, providing their services. There's very few major corporations coming into this area. The third thing is that when NDIS was discussed, there was a couple of ambulance chasing corporations from America came out and did a tour. I'm sure there's people, if people are connected with the NDIS, they may well have run into these people. All of them came out, they're very, very smart. They know how systems work and how disability works and where the profit is. They all came out, looked around, and all went home again and said they'll come back in 20 years. It's grown up, it's a mature system. So I think that the discussion around for-profit versus not-for-profit isn't helpful, and I don't think in reality the for-profit side is getting into this because there's no incentive with pricing to invest. Why would you invest? The final point that I would make is that the not-for-profit human services sector generally, and disability services providers particularly, are not replaceable. And so we don't want a situation repeated of that we had in employment services, you might recall in the Howard years, when the Howard government determined that we should have for-profits providing unemployment services and supports. For-profits came in, they spent a bit of money, kicked a few tyres. 5 years later, they got out. But in between time, the Salvation Army and other providers had to exit the industry because they couldn't continue to operate with the income levels that were provided. And so what we found was that, in fact, it took about 10 years for the sector to recover and to be able to then provide those services. And obviously, I want to see that in disability services. The absolute final point on that, I keep saying final point because I'm a good lecturer and I don't want people to pack up before I finish speaking, but the absolute final point on that comment is the fact that at the end of the day, this NDIS is not one service. There are hundreds of different types of services provided, and a mix of those services means that some of those services can be profitable and some not. And what we're finding is the bulk of those non-profitable services are continually being allocated to not-for-profit organisations, while for-profit organisations pick the eyes out of, cherry pick what they can provide in order to make money. And that arrangement is, or rather there's significant evidence of that happening in other countries as well, where quasi-markets are used to allocate resources, and the market mix adopted by for-profits is detrimental to supply across the whole sector.
So, effectively what's happening is that the not-for-profits are, because you've got a quasi-market, are basically competing with each other. Are they driving the prices down for a sector that's already got pretty low wages and low conditions and heavy responsibility? So it seems like we're just getting them to scratch each other's eyes out. It's ridiculous.
It's a great comment, John, and pardon me. What I've noticed, and it's anecdotal, so others might have a different opinion, but what I've noticed is it certainly started off with people keeping their cards close to their chest and going into that competitive pose so that they didn't share information. But the sector very quickly realised that, number one, we're not competing because there are so much demand. There's up to 500,000 people needing services. There's these utility problems where are demonstrated by the lack of NDIS money being spent because people can't spend it. What's to compete? There's more clients than there are people to provide them services. And then secondly, people are realising that collaboration and specialisation is actually a good sustainability tool. And so the last 3 or 4 years, probably the last 3 years particularly, it's been very, very good to see organisations actually say, you know what, we need to reveal what we know, we need to work together with this.
And they don't get in trouble with the ACCC for colluding or for
No.
Okay.
Well, not so far anyway. I'll be interested if anyone's had that experience.
Yeah. A couple of questions which are sort of linked. One of which is I asked, which was about what's really behind the Commonwealth's market approach. Is it to save money because it seems so, in a sense, unnecessarily complex? But linked to that, maybe if it is a money-saving thing, there's also a moral hazard problem here, isn't there? Does the supply create its own demand? If you make the system better, then unmet demand suddenly will appear. So, in a sense, what's in it for the Commonwealth firstly overall, but secondly in taking this market approach? What are they getting? What they actually want, or not?
Look, I think there's a couple of things. One, what I call the Australian love affair with market economics, and talking about everything as being a market. I even heard this a couple of years ago, but someone talking about the market for religion. At the end of the day, I think we've got to be aware that there's a rhetorical attractiveness to markets in Australia, probably the developed world, that means that this is always the go-to place. And we talk about markets, even when we are not talking economically, we have a tendency to describe things as markets to be able to slot things into the right barrel and say we're talking about the same thing. I think secondly, government is looking for ways to cut money, and I think this is really important. I'm not out there saying government should get its checkbook out and just spend money willy-nilly. $22 billion or 25 or whatever it is at the moment, it's slowly creeping up, is a lot of money. And that should not be wasted. It should be applied efficiently and effectively. But the fact is, markets or quasi-market arrangements don't achieve that efficiency. What achieves efficiency in human services is collaborative co-production between government not-for-profit organisations or providers and those service users that actually are in the best place to describe the services they need. So I think that those two things are really significant drivers of this mentality in governments and in the sector, I might add. A lot of sector leaders have the same mentality around market utility of markets and driving this behaviour. The third and more sinister perspective or comment I would make is that I think being able to blame markets relieves government of some of its responsibility as well, because you're saying that this economic structure works. We all know that markets work well sometimes and not. We all know there's up and down to them. And it's pretty harsh to align those to government. There's a lot of things in Australia where we're an economic taker, not a giver. But I do think there's some attraction to the policymakers to talk about markets, because it does mean that I don't have to do anything. It's the market's going to play out. It's not me, it's the market.
And is there a danger that basically over time things will just ratchet up? I mean, it's unlike Medicare is, if you like, a demand-driven system and it's uncapped, whereas this is not really. This is not. It's capped by how much money the government's got. Sure. As it turns out, they're not actually spending all the money they have got, but in theory, there's nothing to stop them effectively hitting the cap, and then they'll have to ration the services. Is that right?
Well, it's a ration anyway. So at the end of the day, NDIS is a rationing system, the same as the other grant-making system. But I'd comment in two ways. Number one, I don't think it's necessarily a case of having more money. The argument for me is not about having more money. The argument for me is about having a systemic approach to designing and implementing an industry plan that's going to achieve an outcome. And there's money to be able to do that. And I think that will actually result in savings ultimately in the system. And if not savings, certainly operating within the budget frameworks that we've got in the broad context. So I don't have an argument that the government should go around and just dish out more and more money to solve these problems, because they're not money problems, they're systemic problems. The second and more insidious issue, though, John, is that at the end of the day, the only demand that we're aware of is those people that have been captured by and got a plan for the NDIS. We know, though, that there are many people out there that have not been able to be captured or incorporated into the funding environment. And so, therefore, what is really disturbing is that if the known demand's not being met, I'm pretty sure there's unknown demand out there, unquantifiable demand, where people simply fall through the cracks. And so the overall impact is to have a significant community problem, probably in most low socioeconomic areas, remote communities and so on, but also in run-of-the-mill suburbs and cities as well. So we just simply won't know that that's there.
I mean, there's one of the last comments to come through, which is pretty much confirming what you also said, saying even in not-for-profits, there's reductions have led to less investment in staff and staff having to pay for their own qualifications and training. So yeah, that market sort of or quasi-market mentality, if you like, is driving seems to be driving costs down rather than investments and up, it seems. So
absolutely, and the pricing structure doesn't allow for a lot of those costs in any case, so they're not recognised as being legitimate costs. But also an added challenge for employers in this area is the fact that because it's predominantly, it is the lowest paid or one of the lowest paid industries in Australia, those people that are able to work in the industry or attracted to the industry are often also new Australians. And so not only do you have the combination of needing to teach people, train people, give them experience in terms of the care operations that they've got to administer, but then you've also got cultural and other linguistic and other challenges in that regard as well.
I mean, this question will lead to another question. Probably the same person asking the question before was saying that the LACs, at the local area committees,
yeah,
were local. They knew their people and they were who they were supporting, their families, and weren't to be processing people as the NDIS planners are doing. I mean, with that localised point of view, is there? I mean, are any states now having second thoughts and thinking, you know what, we might be better off when the agreement comes up for renewal to actually think about either renegotiating it to give it a more local flavour or to even get out of it completely? Is there enough, or are the disability groups themselves to some extent divided, and hence there's no unified view about what their state government should be doing?
Yeah, it's a really interesting one, John. I think in practical terms, so the short answer is I couldn't tell you, that whether or not there's ministers or senior people making those kinds of comments. Certainly in the bureaucracies, I would suggest to you that people that were here before NDIS would have those feelings. But you've got to remember too that the state and territory bureaucracies are largely being dismantled. So IP, experience, corporate memory of what went before the NDIS is being eroded at I think, an ever increasing rate of knots. And so therefore, you might say the system's not working now, but you might also not have a memory for what was good about the previous.
Yeah, and as you said, part of one of the main objectives behind the states signing up was to effectively reduce their administrative / political burden. Well, then it's not their problem anymore; it's the Commonwealth's problem. So why do they need to bother?
That's right. That's right. I think that's right. Yeah.
Okay, David, I think we're just about, hang on, I've got my very last one, which is just a comment really, which is you get what you pay for. The employer is simply employing whoever they can get, a low paid job, not great recruitment strategy, which is clearly that's what's going on, but which is actually not a lot different from what it was like for the last 30 years, I'm assuming. So
well, it wasn't. I think a couple of things are probably important to recognise as well in all of that. And why I talk about a system view rather than an NDIS view. So if the big problem is if we have unmet demand in NDIS, then we have state hospitals and state health services and other state services picking up the tab on that. So effectively, one of the reasons I objected to the Western Australian transfer into the NDIS system, if you like, was because there are a bunch of hidden costs in the state health system that are just not being recognised. And so taxpayers in WA are paying twice.
Sorry, did the classic muting myself. Okay. Well, look, David, I think we've probably exhausted you for all those questions and the presentation. So look, it's been very good of you to provide that fairly sobering outline of what's going on with the NDIS. And so on behalf of all our Curtin Corner viewers, it's been great to have you present the talk today, and I think we're all a lot more knowledgeable as a result. So I'm not sure, Lisa, if we can come back to me on the screen, but if not, here we are. Thanks, everybody. So David, yet again, thank you very much for your presentation. It was really good. And for those of you in Curtin Corner land, just letting you know, we've got the new semester starting. So next Friday afternoon, 4 o'clock, we have a speaker, Tanya Ciccone. Tanya is the Executive Officer for the CEOs for Gender Equity, and she'll be talking about COVID-19, the compelling case for workplace change. So please join in and at that session as well. We did get a question saying, why can't we do a hybrid of both in-person and videoing that, which we may well think about. Part of the problem is that because we've got these limits on numbers, we then have to have an extra complication of working out who the lucky 30 are who come along to the event, and it can be a bit annoying trying to do that. We don't want to have to turn people away, which would get really A, embarrassing, B, annoying, and C, it's not really worth the trouble. So I think at the moment, while we're still not quite in the fully opened up situation in Western Australia with the Victorian situation, I think we're going to stick with the online webinars for now. I'm sorry for those of you who want to come along, but that's just the way it is. But hopefully we'll get the technology working absolutely perfectly from now on, and you'll enjoy the sessions. So thanks again for attending. Thank you again, David, for presenting, and we'll be able to see it again online. You get the slides and everything, and hopefully we'll see you next Friday afternoon. So thanks very much. See ya.
Thanks, John.
See ya.